Hi, everyone. Thank you for having me today. My name is Sheri-Ann. I'm at Emory, and I'm excited to ignite some thought and action surrounding this topic, attacking sex trafficking in your emergency department, the myth-busting edition. So I want to start with a take-home message. Traffic victims are coming to our emergency departments, and we are missing them. In a study with 98 survivors, 88% of them said that they had seen a healthcare provider while being trafficked. So we need to educate ourselves and be prepared. So let's clarify some things. Trafficking and smuggling are not the same thing. Smuggling is the movement of people across borders, whereas trafficking is the recruitment, transportation, harboring, or receipt of persons. And there has to be a means and a purpose. The means include force, fraud, or coercion, as well as abduction and deception, for the purpose of exploitation, some type of gain of an individual taking advantage of another, monetary or otherwise. This is not just a foreign issue. Trafficking is happening in the U.S. to U.S. citizens. In this study by Banks et al., 85% of victims were U.S. citizens or legal residents, and even more shocking, more than half of them were minors. I want to distinguish sex work and trafficking. Remember the definition. There has to be force, fraud, or coercion, except for minors. Minors cannot consent, so any commercial sex act would classify as trafficking. Now, statistics. They're not very reliable. Trafficking is largely underground, very difficult to study, so it's hard to tell which city has the most trafficked victims, how many there are. What's important is to take each fact and think critically about them, such as the Super Bowl, very hot topic. While there is an increase in advertising for the Super Bowl, there has been no evidence to suggest there's an increase in trafficking. Trafficking is happening every day, and we should treat our approach as such. I want to warn against sensationalism using the shock factor. This can lead to false information and really poor credibility of the anti-trafficking movement. So we try and move away from using these hot topic statistics. So something that is well studied are risk factors. So for children, huge risk factors are child abuse or running away from home. And in all populations, you'll see drug abuse, involvement with law enforcement, etc. Now, some might argue that this is a problem for law enforcement and the government, but physicians are responsible too. Trafficking affects health in very large ways, mentally and physically, and they're coming to our emergency departments to seek care. So far, screening in the emergency department has mostly been based on physician gestalt, which is very important in our practice, but a recent study found that 40% of, or physician concern was only 40% sensitive. Two physicians can see the same picture and think two different things. So we need a standardized approach to screening. We need to detect patients based on evidence-based red flags, chief complaints, as well as creating opportunities for self-reporting, such as placing a sticker on a urine cup. Unfortunately, there are no validated screening tools in the healthcare setting, but there are several resources that have compiled evidence-based questionnaires that we are able to refer to and use. So for example, in our emergency department, we use these resources to compile a screening tool pertinent to our population. This is the first question. It's from a study by Mama et al., and all their true trafficking victims said yes to this question. So very, very sensitive for this population. We also made sure our questions asked about force, fraud, and coercion to make sure that they were meeting federal criteria for trafficking. So these are all the questions, not intended for you to read, but questions asking about force at home or in the workplace. And then we have these questions asking about coercion, which is using some type of influence to alter decisions, as well as a question about fraud or being lied to. And the most important question is, are you interested in leaving your situation? Which brings us to our next myth. Not all victims want to leave their situation for a variety of reasons. Trauma bonds, addiction to drugs, threats to their lives and families. But I would say that screening in the emergency department does create an opportunity for those who want to leave. And in our implementation, we've already rescued 5 from trafficking. Now, it's not just all about sex trafficking, there's labor trafficking as well, very poorly studied, but something that we want to refine our tool to address as well in our population. These are my resources and references. The Polaris Project is a great tool for learning more about this topic. Hill Trafficking is actually a group of healthcare professionals in the fight against trafficking, and there's more myths and misconceptions at that website. And lastly, if you suspect trafficking, I would suggest you call this number, the National Human Trafficking Hotline, whether in the emergency department or elsewhere. Thank you so much for your time.